Some tips to help a patient brushing for the first few times with their braces. We do recommend throughout treatment brushing twice a day, definitely in the morning, definitely before they go to bed. Usually after any meal they should try to brush. So if they can't brush at school, a lot of times that's hard to have the time for that. They should be brushing as soon as they get home from school to get some of the food and things that get caught throughout the day. We do recommend an electric toothbrush, also a water pick. Any type of toothbrush is certainly fine as long as the angle of that toothbrush is correct around the brackets, which we do teach the patients the day that they get their braces on.
This is a growth appliance, also known as a CBJ appliance or a Herbst. Some problems that can occur with this appliance is if you open too wide, what can happen is the rods and sleeves will disconnect. Once the rods and sleeves disconnect, the top part can actually slide off. To put this back on, you're going to slide it in at a 90-degree angle and push it back towards your ear. And then you're going to bring it forward, and then you're able to put the rod back into the sleeve. Another issue that can occur from having this appliance is if a crown comes loose. If a crown comes loose, it will wiggle up and down on the tooth. If any of these problems occur, you do need to notify the office if you are unable to fix them at home by yourself.
If the arch wire should break, the patient needs to notify us as soon as possible. At that time when they notify us, we'll be able to pull their chart up to see if they're coming in for an appointment soon. If they are, then we can just probably see them at that appointment, or if it is an emergency, we will bring them in earlier to change that arch wire.
If you have a fixed appliance in your mouth and it is cemented on with bands, and we would tell you that when you got it, that would be an expander, a penguin, lingual arch, something like that. The first thing you do is look in the mouth, whether it's your daughter or your son, and make sure the band is loose from the tooth, it's sliding up and down on the tooth where it was glued, or are there two metal pieces broken apart, like maybe where a wire is welded to the band. That needs to be told to the person that you talk to when you call into the office, and do call the office as soon as it breaks, and then we'll take it from there. As soon as we know what is broken, we can schedule you to get that repaired. Make sure that you are watching what you eat, that you're not eating anything hard or chewing anything hard that might break it off.
The patient should find out they have a broken bracket. What the broken bracket will look like, it'll either slide on the wire or it could come out of the mouth. If that happens, they need to notify us as soon as possible, and we will bring up their chart and check and see if we should bring them in earlier to fix the bracket, or if they are okay, just wait until their next regular appointment to get the bracket fixed.
Some things that could damage your braces would be things that are a little too hard. One would be ice. You can't chew on ice like if you have a soft drink. Braces are put on pretty securely and they're meant to come off later. So if you bite on something that's a little too hard, you can pop them off. So if you can slice something up or cut it up to make it not hard, then you can eat it. Like if you wanted a carrot or an apple, don't bite into the apple, slice it thin. You can eat it, make it not hard.
Patients that are involved in sports, we do offer mouth guards to our patients as a courtesy. Sports specifically would be football or field hockey, also lacrosse, anything that is more of a full contact sport. We definitely recommend those, but we can offer those to any of our patients that would like one.
The first few days after initially you get your braces, your teeth are going to move and you're going to feel that. So the first maybe 3 or 4 days you're going to have sore teeth. That's going to gradually get better throughout the time. Anything you normally take for a headache, which would be Tylenol, Advil, will help ease that discomfort and take away the initial discomfort, and that gradually gets better over time. We also have wax. If anything ever bothers your lip, you can put a little bit of sticky wax on the bracket, just cushion it and make the inside of your mouth feel better. We have a couple products, Paroxyl and Orabase. Paroxyl is a minty flavored antiseptic mouth rinse, and that will help disinfect and heal any sore. And we have Orabase, which will numb any little sore for you. So they're great products. We have a lot of things that can help you through that.
If a patient has a wire that's poking, which does happen occasionally throughout treatment as the teeth move and change, those wires do get a little bit longer in the back sometimes. They are welcome to come in and have that wire trimmed, but we also provide wax. They will take home with them that day that they get braces. We offer a little bag of some things to make it easier for them to get used to their braces. They can use a little piece of wax in the back, pressing that firmly against the wire to prevent that from poking until they can come see us.
If an emergency should develop after hours, we are available for you to get in touch with us. Either myself or Dr. Alizadeh will have our after hours emergency number on our office recording that you can get in touch with us. We'll make sure that we can help you to find a way to be comfortable and get you through that situation. Simple things like a broken bracket or a poking wire generally can be remedied with wax or something like that to get you through the short term. But if something that is a true emergency exists, we want to make sure that you can get a hold of us.